question.
My name is Maureen Smith, and my question is for Darian. I was quite interested in your comment that anxiety and depression were, in the past, considered symptoms rather than diseases. And I was wondering what the disease they were a symptom of was called at that time.
Okay, hold.
That I think it's not that there's an epidemic, but rather that there's some misbranding and off-label sort of encouragement of doctors to use medications for those things, and that would be my point.
Okay, panel, these are really good questions, but I'm afraid I'm going to give you 1 minute to respond to them. They've all been directed to individuals. So, Darian, do you want to take Maureen's question first?
Yeah, it's a very good question. It would depend on the diagnostic system that the particular person was using. So, I mean, there are a lot of systems operating at that time, but these things were never seen as disorders in themselves. And one of the crucial mistakes made by the contemporary diagnostic inflation.
Like that?
Can you hear me?
No. There we are.
Is that
fine?
Okay?
Oh, it's working again.
It's working now. One of the big problems made today is if you take, let's say, a category like OCD or anxiety and see it as a disorder, that gets rid of the subtle distinctions made by early psychiatrists between the same phenomena, the same rituals used by a person that would be classified today always as OCD, when they were used as a defence against another underlying problem. So, for example, it was well known in old psychiatry that the emergence of OCD symptoms in the case of manic depression was a positive sign and they should not be treated. Today, it's very likely the person will get a medication for the manic depression and for the OCD. Yeah, so by losing that distinction between symptoms and underlying structure, you're collapsing the efforts the patient is him or herself making in order to find a solution for themselves.
Thank you. Thank you. Declan, do you want to respond